Thank you. Well, I have the privilege of looking at the topic of functional consequences of hearing loss. And there are some interesting parallels with the literature that Marilyn reviewed on the cognitive consequences. As others have mentioned this morning, hearing loss is seen by many to be basically a communication disorder, but hearing loss may have much more wide-ranging consequences, such as those that Marilyn talked about in the cognitive area. And in the functional area, it's been hypothesized by various people that hearing loss can increase the risk of falls and injuries. It could lead to increased limitation in an individual's function as well as subsequent disability. And it can reduce one's activity and participation, which can lead to decreased quality of life. These are very broad topics, and I certainly can't cover the full range in a 15-minute presentation, but I'll try to touch on some of the highlights in the research that's been done. In terms of the functional consequences of hearing loss, I'm going to highlight some of the most recent longitudinal studies on the potential functional consequences, and then I'm going to try to draw some conclusions and make some recommendations for future research in this area. So the first question is the one of whether or not age-related hearing loss may be related to falls. And here I'm going to focus on some studies that have been done in Finland, the Finnish twin study that's looked at falls risk. These investigators hypothesized that hearing loss would lead to increased risk of falls, and they postulated that postural balance would act as an important mediator between hearing loss and subsequent falls. They studied 423 women. The mean age was 68 years, and hearing loss was assessed using a clinical audiometer, and postular balance was measured on a force platform. Falls were tracked on 12 monthly calendars. The findings from the Finnish study is that falls rates for the best to the poorest hearing quartiles were in fact related, 7.1, 6.7, 10.4, and 11.3 falls per 100 person months. 2 or more falls, 30% in the poorest hearing group reported 30% 2 or more falls versus 17% in the best hearing group. Higher falls risk was partially explained when they looked at and controlled for postural control. However, even after controlling for posture, those with poor hearing still had a twofold increased risk of falls. The second question I want to touch on is hearing loss related to limitations in one's function. Here again, I'm going to turn to Finland and the Finnish twin study, where they looked at the impact of hearing loss on walking ability. Again, this was focused on women only, age 63 to 76. They had follow-up measures over a 3-year period. They used a clinical audiometer, and for walking speed, they looked at 10-meter maximal walking speed measured in a corridor using photocells for timing. They also looked at the 6-minute walk test to look at endurance of walking, and they used a patient-reported outcome measure of one's perceived difficulty in walking 2 kilometers without resting. The findings from this study with respect to hearing loss and walking are as follows. First of all, 41.2% of the participants in this study had impaired hearing correlated cross-sectionally with poor mobility. In age-adjusted logistic regression, the women with hearing loss had twice the risk, an odds ratio of just over 2, for new major difficulties in walking 2 kilometers as those without hearing loss. And then for another study that's looked at this issue, looking at both function and disability, I'm going to go to the study of Chen et al., which is Frank Lin's group, where again they used the Health ABC cohort study to look at the impact of hearing loss on function and disability. As Marilyn said, it's a prospective cohort study with annual visits. And for this study, they looked at years 1, 4, 6, 10, and 11. They had over 2,200 adults from 2 states and they ranged in age from 70 to 79. They looked at uncorrected hearing loss measured by pure tone audiometry. Lower extremity function was measured by the SPPB index, which is an index that includes measures of gait speed, standing balance, and one's ability to rise repeatedly out of a chair. They also looked at incident disability assessed using a patient-reported outcome instrument that was not specified in the publication. They observed a small dose-dependent effect with greater levels of hearing loss associated with poorer function over time, and among women, interestingly, greater risk for incident disability. The results were robust to adjustment for multiple potential confounders in their analyses. This shows you some of the data. They looked at it visits 1, 5, and visits 11, normal, mild, and moderate hearing loss, and you can see the magnitude of the differences. Women with moderate or greater hearing loss had a 31% greater increased risk of disability compared with those with normal hearing. This association was not seen for men in this cohort study. Fully adjusted analyses restricted to individuals with mild or greater hearing loss found that individuals who used hearing aids had function scores at visit 1, 5, and 11 that were not significantly different than individuals not using hearing aids. No significant attenuation in the risk of incident disability associated with hearing aid use. So interesting, and this goes back to one of the priorities that Marilyn talked about in the cognitive area, which I think is also extremely important in the physical function area, is to really investigate carefully whether or not hearing aid and other forms of adaptation to age-related hearing loss, will they have a moderating effect of these kinds of relationships? In this study, that was not observed. However, as the authors rightly point out, the measures of hearing loss are very crude in this cohort study. Data on hours of hearing and worn hearing use and hours of day that they wear the hearing aid, the number of years that they use the hearing aid, the adequacy of auditory rehabilitation, none of those were available in this study. They just had a crude measure of whether or not someone used a hearing aid or not. It did not have an attenuating effect on the relationship that they saw. Now, going on to the Alameda County study, where again they looked at a variety of measures of function and disability. This was published a bit longer ago. This is a one-year prospective cohort study with just over 2,500 subjects. They used a patient-reported outcome measure of hearing loss, and they measured it even with the use of a hearing aid. So they were looking at not pure tone hearing loss, but hearing loss with using a hearing aid. 48.5% reported some hearing loss, 17.1% reported moderate to severe hearing loss. They looked at the association of hearing loss with the ability to perform ADLs, IADLs, physical performance measures they had, measures of depression, and measures of social participation. So they had a wide range of functional outcome measures to look at over a relatively short period of time. In terms of their findings, interestingly, they found no consistent association with hearing loss and performance of ADLs, IADLs, or physical performance. They did, however, see a very clear association with social functioning. And these are the measures that they used. They had measures of social functioning that included a question about feeling left out, feeling lonely and remote, hard to feel close and can't pay attention. And these are odds ratios for those with mild loss and those with moderate or greater loss. And so they did see a consistent association with social functioning, but not with any of the measures of physical functioning that were available in this study. And finally, the question of going beyond physical function and looking at more disability behaviors such as driving, the question of, is hearing loss related to driving behaviors? Now, when you look at this research, past research has shown that people with hearing impairments do appear to be more likely to have stopped driving. And I referenced this particular article that reviewed some of the literature. And then in a Quebec study, they looked at daily noise exposure and measured hearing loss, and they saw that it was associated with greater risk of traffic accidents, as recorded in a database collected from driving records in Quebec. So they saw a very clear association with those exposed to daily noise with measurable hearing loss and traffic accidents. And then I want to call your attention to a study in Australia, Queensland University of Technology, published in 2010, where they studied 107 men and women with a mean age of 73.5. They measured hearing with pure tone audiometry, but in addition, they used patient-reported measures of the hearing handicap inventory for the elderly scale. And they reported that 26% of the subjects had mild hearing loss and 19% had moderate to severe hearing loss. They drove a 5-kilometer closed course wearing glasses and or hearing aids. So they allowed them to adapt to the hearing loss if they usually wore it. They drove with and without auditory and visual distractors. They had both verbal and visual requests to report sums of numbers presented while driving as the distractions. Can't imagine doing that, but they did. I would love to get that by the IRB. Interesting, they found no individual hearing measure, whether it was the pure tone audiometry or the patient-reported measure, associated with overall driving performance on the closed course track. No association. And they controlled primarily for age in their analyses. But interestingly enough, they did see a significant interaction between hearing impairment in the presence of the distractors. People with moderate to severe hearing impairment had significantly poor driving performance in the presence of distractors as compared to those with normal or mild hearing impairment. So, to summarize, in terms of the state of the science on the functional consequences of hearing loss, existing studies on the association of hearing loss with incident functional decline are really inconsistent. Some studies demonstrate a positive association, others find weak or no significant association, but it depends on a lot of factors, primarily having to do with what specific functions one is looking at and how one measures the hearing loss. Hearing loss, when you look across the literature, from my reading of it at least, it appears clearly to have some real but relatively modest functional and disability consequences based on the literature available today, which clearly could affect one's quality of life. However, the heterogeneity in the study results is likely explained by many differences across the studies. The state of the science is far from mature in this area. There are many differences in how hearing is measured. Some use subjective self-report, some use objective clinical audiometry. Whether a hearing aid was used many times is not taken into considerations, and in some of the studies it's not even reported. What disablement dimensions are being assessed are vary widely, looking all the way from falls to walking to performance of ADLs, IADLs, social function, and driving behaviors. So in terms of future research, from my perspective, I think we need to really clarify what's the right exposure variable for the specific question that we're interested in. Uncorrected hearing loss is most commonly assessed in these studies, as was in the cognitive studies. I find fascinating the question of whether or not hearing aids and other forms of correction for hearing loss is going to have a modifying effect on these kinds of associations. That work has really not been done, much like what Marilyn pointed out in the cognitive area. It's not been done in the physical function area, as well. From my perspective, prior to jumping into controlled trials, I would love to see some really careful observational studies with and without correction over long periods of time before we really commit to doing trials in this area, at least in the physical function area. When the focus is on disability behaviors such as driving, from my perspective, as well as things like social participation, I think hearing loss with correction may be a more meaningful exposure variable than pure hearing loss without correction. If you want to know whether or not it's going to have an effect on what people do in their real lives, it seems to me, just like with vision loss, you would never study the effect of vision loss on driving without correction. Seems to me with hearing loss, the same approach should be taken when the interest is disability-type behaviors such as driving, as an example. And then finally, from my perspective, the functional outcomes on the surface seems very simple, but in fact, this is a very complex area. And we really need to clarify those most important functions that may or may not be related to hearing loss, and not just pick those that are available in the existing cohort studies, which tends to be what we do, and understandably so. I do it all the time. One's capacity to perform key functional tasks, such as walking, and prevent such events such as falls are critical for further exploration, as well, in my view, of looking at disability behaviors such as driving, social function, ADLs, and quality of life. Thank you very much.